Welcome to our very first open house at the foundation. We thank you so much for taking the time to join us this afternoon. So, as you probably read in our communications, we're hosting this event to formally introduce ourselves to you and also to share a little bit about where we've come from and where we're headed. You'll notice that throughout the talks, our chat is going to be open. And if anybody wants to post in there, you guys are welcome. We're actually going to be dropping links throughout the talk that's going to lead you to different resources that you might want to look into. So feel free to keep your eye on the chat and you'll be able to access some different resources as we go on. Cheney, next slide. Okay. So I'd like to first start off by introducing our team. My name is Lynn Hernandez. I'm the executive director. I've been with the foundation for about 12 years now, and in this role for about a year and a half. So I will kick it off to Debbie now.
Hello, everyone. I'm Debbie Nathan. I'm the development director here, and I'm located in the Dallas, Texas area.
Hi. Hi, everyone. I'm Cheney Pope. I'm the communications manager here at the DTRF, and I'm located just north of Denver in Lafayette, Colorado. And thank you, everyone, for joining us today. We've been so excited, and we couldn't wait to see all of you.
Thank you.
So also I'll just share that in mid-May, we'll be bringing on an operations manager. Her name is Pearl. We're very excited to have her on board, and you will, I'm sure, see her in our communications and our meetings, et cetera, going forward. I'd also like to add as a disclaimer that our staff are not medical professionals and that we are not patients or survivors of desmoid tumors. We do, however, have a deep understanding of the dynamics in the rare disease patient advocacy space. All right, Cheney, you are on it. Okay, so we'd love to hear from you guys as well. So let's go around. We'd love for you to share these three things: your name, where you live, and your connection to the community. Are you a patient, caregiver, etc.? So why don't we start off with Sheila?
Hi, everybody. Can you hear me?
Yes.
Good?
Yes.
My name is Sheila Folkstead. I live in the Twin Cities in Minnesota. And my connection to the community is my first husband, Scott, died from complications of his desmoid tumor related to the FAP that's in his family. And our daughter, Maggie, who is now 30, also has FAP and has had desmoids. They found desmoids over 10 years ago. And she has actually done very well with her desmoid. She's got other complications due to her FAP, but that is my connection.
Okay, thank you. Thanks so much for sharing. Rizwana?
Hi, everyone. So sorry, I'm getting up dinner here. It's 7 p.m. in South Africa. I live in Johannesburg. My name is Rizwana Mohammed. I was actually recently diagnosed with a desmoid tumor. So I'm gonna just give a little bit of background. I was pregnant, and then started experiencing shoulder pain during my pregnancy, which I just thought was pregnancy related. My baby's now 8 months, and something made me went and check in January, and that's when we picked up the desmoid tumor. So it's in a funny location. It's in my shoulder, which I also think is quite rare. So shoulder and neck region. And I'm basically new to this whole thing and would just love to hear what's out there and what my options are. So I've got lots of questions for you guys.
That's great. And if there's anything that we're not covering that you want to talk about one-on-one, Rizwana, we can connect about that offline if that's of interest as well.
Thank you so much. Appreciate that.
Of course. Yating?
Hi, everyone. My name is Yating Wong. I live in the Bay Area in California. And my connection to DTRF is basically the same age as my oldest son. So my oldest son, Isaac, was born with a desmoid tumor primarily in his right orbit. And he's blind in one eye, and he's tried pretty much every treatment that DTRF has helped us surface over the last couple of years. He's 8 years old.
Thank you so much, Yating. Diane?
Hi, I'm Diane Podest, and I live in New Paltz, New York, which is about 2 hours north of New York City, up in Ulster County. And my connection is that I am a patient. I have a desmoid tumor in my right axilla, so tucked up under my armpit. And Desmoid Tumor Research Foundation has been very helpful with me in my recovery. This long process. I've been here. I've been going to Sloan. I think I'm going on 6 years in August. So so hello everyone. Thank you so much for hosting this event.
Wonderful. Thank you so much. Maria?
Okay, there we go. Hello, everyone. My name is Maria. I was first diagnosed with a desmoid tumor in 1994. When my son was born, I just thought that it was something to do with intestines. And at that time, desmoids were taken out. So it was in my left groined area. So I was open up, the desmoid was cut, and they took they took a lot of organs that were just even near it. So I lost part of my intestines, ovaries, uterus, muscle, and so on. And then I did radiation after that. And then fast forward to 20 in August, I was at the gym and I just had some pain here. I thought that I had sprained it. So tried 6 months of physio and nothing worked. Did a, all of the imaging. And what was interesting was that when you go for imaging, they do the shoulder here and then they do the chest. No one knows to look at the axilla, right? So Diane, I have the tumor in my left axilla, so it's pretty big. It's going through the ribs. It goes up into the brachial plexus, around one of the main arteries. So I've been on Nexavar, and the reactions were too much. So I have switched to the chemo, the systemic. So I'm doing a methotrexate vinorelbine treatment now, and I have 5 treatments to do. I have finished 67 of those treatments, so it's been a long haul. And then just noticing that the tumor pain is not going, like this tumor pain is subsided, but it seems to have appeared in my, like the back of the axilla, the medial axilla now. So I'm thinking that Ogsiveo is next, but I'm in Canada. I'm in Ontario in a city called Whitby. And it's not approved yet, but my oncologist Princess Margaret is working to get that medication approved. So it's been a long journey. And I get my strength from everyone in the group. So thank you for sharing, and thank you for hosting.
Thank you so much for sharing. Alex? Alex, do you want to share next? Okay, we'll move on to Rachel. Okay, Kim's up next. Kim, do you want to share?
Sure. Hi, my name is Kim Unraw, and I live in Tacoma, Washington. I'm a desmoid patient, and I was diagnosed in 2019 with the desmoid in my abdomen, so an intra-abdominal tumor. And then I had surgery in May of 2019, so coming up on 6 years next month. And that same year, I was able to attend the the patient conference in Philadelphia. So that was really helpful since it was all unknown to me up until that point. So I appreciate this great foundation, the resources that you have.
Thank you so much, Kim. Diana?
This is Diana. I'm in Florida. Can you hear?
Yep.
Okay. I'm in Florida and I'm new to this. I've known that I have a desmoid tumor since April of last year, so about a year now. And it's up under my left rib cage. And unusually, my daughter, who's in her mid-40s, also has a desmoid, and we do not have FAP. So it is somewhat unusual, I think. Hers was quite large. Again, it was on the left side, but it crushed her lungs. It was the size of a football. And she ended up with surgery. Mine is smaller and I'm preferring to just do watch and wait. It hasn't grown in the year that I've known that I've had it. So that's what we're doing at this point.
Thank you so much for sharing, Diana. And we really appreciate you guys taking the time to get on this call and kind of not only share with each other, but to learn more about the organization and the directions that we're moving. Jeannie, can you advance? Okay, wonderful. So DTRF was actually founded 20 years ago. We turned 20 this year by a patient and a caregiver, Marlene Portnoy and Jeannie Whiting. We were and we still remain the global convener of anyone interested in improving patient outcomes for people living with desmoid tumors. And our work looks like this. We fund research to accelerate the development of therapies to ultimately find a cure for desmoid tumor patients. We collaborate with all of those people and parties at the table, including dedicated researchers and clinicians worldwide, to improve the lives of patients through education, awareness, and support. So here's a graphic that this is really the first year that we have actually been really intentional about creating a strategic plan. It's something that we've done in the past, but we've stepped into it in a new way this year, which feels really, really important because we are 2 years, almost 2 years out from the approval of nirogacestat. The landscape continues to evolve with greater interest in desmoid tumors, which is really, really exciting. This means more people hearing about the disease, more support coming out for patients, which is great. And because of that, there's more knowledge, and there is going to be a quicker path to diagnosis for patients. We're very hopeful of that. So this year we've identified 3 different priorities: education, especially for new patients finding us, like Rizwana here; research, which has always been our guiding focus to learn more about desmoid tumors; and development and operations so that we can efficiently support our work. Okay. Alongside our staff, we're working with 3 governing boards. We have our board of directors, our medical and scientific advisory boards, and we're committed to engaging the most dedicated and knowledgeable team to guide us and really support us as we move along. Next up, Jeannie. So here is our current board of directors. Yating is actually on the board and on the call. We're very grateful she's here. So in the rare disease space, oftentimes, I'm not sure if you guys are familiar with this, but because usually the co-founders are directly affected by the disease, usually the boards they're called friends and family boards, right? So we had a friends and family board for a really, really long time. We were fortunate that our co-founders had loved ones that were very, very supportive of their journey. And they would sit on the board. Over the past year, we've begun a substantial transition, moving from a friends and family board to a board that is rooted in the community. Many of our board members here have a close connection to desmoid tumors, and we're very, very grateful to have their support. So here are our medical and scientific advisory board members. You guys may recognize some of these names. Globally, these doctors are leaders in desmoid, and they guide us in our research priorities from the lab or from the clinic, whether they're researchers or clinicians. So as most of you know, nirogacestat, now Ogsiveo, became the first FDA approval in desmoid tumors in November of 2023. This was a collaborative effort among so many people, along with patients, obviously, at the center, the heartbeat of everything. It was patients' trust in us and the patient voice that allowed us to be such a strong player at the table in this approval journey, which began in probably 2009. Please check out the link that we're posting in the chat, which covers the entire timeline of this approval process. You'll see all these different parties and hands in things, people circling in and out, new business, new companies being created. So it's quite a ride, and it's pretty amazing. Such a small percentage of rare disease patient advocacy groups actually achieve an FDA approval, and we've been fortunate to be one of those companies. Okay, so over the past 20 years, we've worked with our advisors, as I mentioned, who helped us identify key initiatives and focus areas. This was critical for our small team. As I mentioned, we're not medical professionals. We were founded in 2005, just like I mentioned, 20 years ago, and we started funding research actually in 2007. But if you look at these milestones, the ones with the items that are above the yellow line, they didn't start till 2015. It took us 10 years to really get our legs under us to create this kind of measurable impact. We look forward to 2025 being the beginning of another period of growth. These milestones have implications in clinical care, and ultimately that's our focus. Until a cure, more knowledge and better care. We were able to achieve these milestones with the support and guidance, as I mentioned, of these professionals, but also a vibrant and active patient community. So we've included this slide so that you guys can see the concrete ways that we are and have advanced the field by providing educational opportunities. So for example, this global consensus paper, it's educating doctors. I mean, the clinical guidelines are out right now from the most recent version. And those are for doctors. So this is a multi-page document. It was a collaboration of over 80 people, patients, advocates, and clinicians. And this seeks to educate doctors, but there's also, for the initial consensus paper, which came out in like 2019, 2020, there were lay guidelines that were specifically for patients and really broke things down. Currently, we're waiting for the lay guidelines, the patient guidelines, to be published, and they're supposed to come out before the end of the year, which we will share with the community. It's so important. And we've heard patients talk about, I printed everything out, I brought it to my doctor, right? They can actually use that. I mean, because this is a rare disease, there aren't as many doctors that are as knowledgeable as they should be about the disease. So this is an opportunity for patients to advocate about, around their care. Scientific and educational videos in our video library, which is on our website. And this addresses multiple audiences. So we have really, really technical talks in there from clinicians and from researchers, that where doctors that are interested in learning can access those videos. And then we also have videos that are yes, we can. Actually, Debbie or Cheney, can one of you guys go to the consensus paper page on the website and just pull that link and put it in the chat too? That would be great. So these videos in the video library, they're also educational videos. We're doing webinars. We're pushing that information out on Facebook, so that you guys can participate and ask questions, and also so that you can, share these with other members of the community that you might see that they are seeking education as well. We're putting out Facebook Lives to increase the awareness of this disease on a broader range so that we can target a broader community. That's education. We have our Together We Will weekend, which is taking place in mid-September in Chicago this year. And that's a 2-day event that is providing a full day of talks for by researchers and clinicians, for researchers and clinicians, and then an additional day that's specifically for patients, where patients are receiving education not only about treatment options, but the research that we're doing. Then we have the tumor board you'll see there, which is led by expert clinicians who provide input on difficult cases. I mean, we've heard cases. I remember one time there was a tumor board where the presenting doctor was like sitting in a corner with the lights off, and he's like, it's 3 o'clock in the morning here, but I really wanted to present this difficult case. So this is a service that we provide to doctors all over the world, because we have access to these expert clinicians that are global as well. And that's very encouraging for doctors that don't have experience in the disease. And it's also encouraging for the patients that are getting treated by this doctor who's receiving the support. And then we also partner with companies to put out CME programming. And this is great too, because as kind of the, DTRF.org is a hub, doctors come and they can access these CME programs and learn more about desmoid tumors and desmoid tumor patients. And then we have the research part of this slide. So this is research that we fund at leading institutions all over the world. We have our patient registry and natural history study, which collects data from patients. And then after we do data cuts and analysis, we get to share it with the clinician and researcher community so that they understand the disease and the patient experience better. That, again, we're right in the center of everybody in this conduit, of information. And then also the Tissue Donation Project, which we've worked on with institutions like MIT to create cell lines. Researchers from all over the world can use these cell lines to conduct research. And it was crazy. I remember going to a conference, I think it was, I don't remember which conference it was, but I'm walking through, the way these things work is they have these big poster sessions. All these doctors will it's almost like high school science fairs, like a science fair, where there are all these posters and everybody's standing in front of the poster and they're presenting the data that they've and the results that they've learned from their quote unquote projects. And I remember looking at a desmoid poster and I saw that they were referencing the cell line that we funded the creation for, which is just blows my mind. Like it really, comes around. And it's important for you guys to understand that that cell line was from a patient, donated their tissue through the foundation. So very powerful. Okay. All right, Cheney, you're up.
All right, everybody. I just wanted to take a moment. If you have any questions about what Lynn's talked about, feel free to drop it in the chat. We can definitely circle back at the end for some question and answers. And we just want to hear from you. And we can also circle back after this open house too, directly. But we're, like Lynn said, about our strategic plan. Obviously, we're matching fundamental things to our 2025 year. We're really excited about the things we already have in progress, but we wanted to give you guys a snapshot of what it looks like for the rest of the year at the DTRF. So in advancing research, we are going to fund ongoing research grants that we already have in progress. We want to fund a multi-year spontaneous regression study, and then also utilize the patient registry, which you heard a little bit about, but we'll hear more in just a bit, to educate the medical community and inform patient care. As far as the patient education piece, we're really looking forward to Together We Will, which I'll cover in just a couple minutes. There'll be lots of educational webinars throughout the year. We've already had a couple so far, but look forward to hosting more of those. We also will keep partnering with the community and other key stakeholders to celebrate key awareness months like Desmoid Tumor Awareness Month in September, Rare Disease Day that we had in the end of February, and then Sarcoma Awareness Month that occurs each year in July. We also, like Lynn mentioned, host quarterly desmoid tumor boards that are virtual, and then also one-to-one patient support as requested when patients reach out directly to our team. As far as strengthening our development operations internally so that we can better serve the patient community, we continue to engage pharmaceutical sponsors to enhance patient education and research. We mobilize volunteers and ambassadors to amplify awareness and education efforts. And then we really want to showcase research efforts through a researcher meet and greet this year to expand the impact of that collaboration with researchers. So we mentioned a little bit about Together We Will. This signature event is just an incredible opportunity for you to convene with other patients, caregivers, but also clinicians and researchers that are those top experts in the field, some from our medical and scientific advisory boards, and some that we continue to engage with and reach out to. And even we encourage you to invite your physician as well if you want to attend this year. Just go ahead and put that out there. Lynn mentioned we're moving to Chicago this year, which is really exciting. We were in Houston last year, and the events that are going to take place include the DTRF International Research Workshop, which is specific for clinicians and researchers on that Friday, the 12th of September, and the workshop for medical industry and professionals, along with that Saturday, which will be the patient meeting on the 13th. But there'll be time for a meet and greet with researchers as well. There's a lot of conversations and just very collaborative and very welcoming too, where you can just come as you are and bring your questions and conversations. So we really look forward to it and encourage you to be on the lookout on our social media and in our newsletters about our announcement for launching registration in May. Some key takeaway resources for today, which I encourage you to reach out to us if you have any specific questions about these resources or anything else you might find on our website. As Lynn mentioned, it's an ever-evolving hub. So if you're aware of a resource that we aren't aware of, please send it our way. Or if you see anything that you'd like to weigh in on or give our team, please always feel free to reach out to info@dtrf.org. The DTRF Virtual Tumor Board, we mentioned, it's led by Dr. Aaron Weiss. The quarterly DTRF Tumor Board is an international video conference. So we're pulling doctors from around the world and allowing those physicians to really collaborate to discuss really difficult, complex desmoid tumor cases and get that feedback from specialists in the field. It's an incredible opportunity, and your physician can submit your case through our website as well, but it has to be submitted by a physician. The DTRF educational events, like we've mentioned, we hope that we have some more expansion in this area as time goes on. We want to keep hosting those virtual educational events as well as awareness events. We also are trying new things like our Ask the Radiologist event, where you actually had an interactive opportunity to talk with a clinician. And then we hope to host an in-person educational event after Together We Will in Q4 of this year, and then continue those in-person events in 2026. So we're really looking forward to all the ideas that are coming down our pipeline. I encourage you to visit our video library to access all of our past educational content from leaders in desmoid tumors and also patient experiences through our Facebook Lives as well. And just a really a great just diverse array of video content, and you can use the search bar to find specific topics that might be of interest to you. We mentioned the Global Consensus paper, which was co-founded by the DTRF. The treatment guidelines that were dropped in the chat will take you directly to the Global Consensus paper page on our website. It was created by over 80 patients, advocates, and clinicians. So it was a real, again, like Lynn said, a collaborative effort of everybody coming together to weigh in on what was most important to have in this document. It's a great resource for doctors looking for guidance on how to treat patients. So please encourage you, if you haven't already, bring it to your doctor's visit, point people to this resource. And we look forward to, there was a recent revised Global Consensus paper, and the lay guidelines hopefully will be published later this year, but the clinical guidelines are available at the end of June of this year without any payment. Right now you have to have a subscription to access the publication. So we will definitely be pushing that out to our community to let everybody know when those lay guidelines are ready and when the actual clinical guidelines are accessible in June. All right, and I will turn that over to Debbie now.
Hello, everyone. I hope you're grasping all this wonderful information. I know that it's a lot coming at you, but there's so many great things happening here at DTRF, and we're just getting started, it feels like. I want to start with ways to engage. Being the development director, I'm always interested in how to engage our community more and more. One of those is our patient-powered research initiatives. Participate in the patient registry. Donate your tissue. I'm going to read you a paragraph. The DTRF Patient Registry and Natural History Study are powerful opportunities for individuals with desmoid tumors and their family members to contribute directly to research that will enhance our understanding of desmoid tumors. Participation is especially vital given the rarity of desmoid tumors. Every patient experience is a unique and invaluable part of the natural history of desmoid tumors. The next focus is increased patient education. Join our new DTRF Ambassador Program and help raise awareness of desmoid tumors and advocate within the broader community. How do you want to do that? How are we planning to do that? We want to organize a patient meetup locally on behalf of DTRF, help promote events, promoting content on social media, training required, represent DTRF at local health fairs, and we welcome other ideas. My goal with this program is to start having like field staff, people that are out in the community that start galvanizing the community in different pockets of the country, so that we have a bigger outreach. We have more of a campaign to connect with the desmoid community in the United States. And of course, being in development, my goal is always to fundraise. As a small organization, we can only fund research we have dollars for, so we need your help. Every dollar counts. If you have an idea you're excited about, we're here to help. We've got a lot of tools and resources at your disposal. If you just want to connect with me, I'm happy to do so. I know that I recognize Sheila as someone that I could have connected with in the past. And we would invite you all to support our organization. As Lynn mentioned earlier, one of our pillars is development, and to raise those dollars, So it's a major focus for every nonprofit, but especially in this rare space, it's critical. So you can see different options for you to participate, engage with us. I'm always just an email away. I'm happy to engage and help in any way to assist you. Next slide. Okay, this is your opportunity for questions. We've kind of gone a long way here. a lot to cover. But we're so excited. We're so excited about the many things we have to offer our community. And we hope you take advantage of all these great opportunities.
Absolutely.